Did you know that high blood pressure is a silent killer? Let's find out why. I'm Nurse Vindira with By Individual Health and Wellness, and I'm a board-certified functional nurse health coach. So what is blood pressure? Blood pressure is the force of the blood pushing against the walls of your arteries as your heart pumps. It is measured in millimeters of mercury and recorded as two numbers, systolic and diastolic. Systolic is the top number, and this represents the pressure in your arteries when your heart beats and pumps blood. Diastolic, the bottom number, it represents the pressure in your arteries when your heart is at rest between beats. There are 5 categories of blood pressure: normal, elevated, stage 1, stage 2, and hypertensive. Let's go over them. A normal blood pressure reading is typically less than 120/80 millimeters of mercury. Elevated blood pressure is considered a systolic, or top number of 120 to 129, and diastolic, or bottom number less than 80. Stage 1 hypertension is when the systolic number is at or between 130 to 139, and the diastolic number is at or between 80 to 89. Stage 2 hypertension is when the systolic number is 140 or higher, and the diastolic number is 90 or higher. Hypertensive crisis is when the systolic is higher than 180 and the diastolic is higher than 120, and this requires immediate attention. So what are the signs and symptoms of high blood pressure? Well, remember at the beginning of this video, I mentioned blood pressure is also known as a silent killer? That's because you may not feel any symptoms, even if your blood pressure has been elevated for years. This is why it's important to check it out and keep track of your blood pressure numbers, whether it's on your phone or in a book log. I usually tell my clients to go to the supermarket or the pharmacy, as they have these automated blood pressure machines, and you can check your blood pressure there. You can also purchase your own on Amazon or even at the pharmacy itself. The one over your arm is a bit more accurate than the one for your wrist, but you can use either. So back to the symptoms. They can show up if your blood pressure is above 180/20, and you can experience headaches, chest pain, heart palpitations, nosebleeds, shortness of breath, anxiety, blurred vision or other vision changes, buzzing in the ears, confusion, nausea, and vomiting. In my next video, I'm going to finish up this segment by talking about the lifestyle changes that you can make to help prevent or manage hypertension. Be sure to like, follow, and subscribe so you'll be notified when I post that video. I'll see you in the next one. Thank you and take care.